Good afternoon, everyone, and welcome to CASLPO's e-forum on school services in a pandemic. We welcome you, but to begin with, we're going to start off with a few tips. If you close all your other applications, including your email, it seems to help maintain a stable connection. If in the worst case scenario, your connection freezes, we recommend that you exit GoToWebinar straight away and return just by simply clicking on the link again. We do want you to know that the recording and the slides will be posted on the website. You'll find them in the events section of the website, and eForums is on the menu on the left-hand side. So my name is Alex Carling. I am the Director of Professional Practice and Quality Assurance here at the college, and I'm really pleased to be joined in this presentation by Sarah and Samida. So Sarah.
Thank you, Alex. My name is Sarah Chapman-Jay, and I'm Advisor for Speech Pathology, Professional Practice and Quality Assurance. And I would like you to be introduced to Samida.
Thank you. Good afternoon. I'm Samida Joglekar, and I'm the Audiology Advisor and Manager of Mentorship.
Excellent. So the topics we're going to cover today is information from the Ministry of Health and the Ministry of Education. And then we received an unprecedented number of questions before this e-forum, which we were thrilled about. And we have incorporated very many of them into the presentation today. However, this is a forum, which means that we will also be answering your questions live today. And we're going to finish up with a message from the Ontario universities regarding clinical educators. So stay tuned for that at the end. So how is this e-forum going to work? We're going to ask you to write your questions in the question box on your screen. Samida will be monitoring these questions. Now, I do want you to rest assured that we save all unanswered questions. It must be frustrating when you send us a question and we don't actually get round to answering it in the presentation. Please rest assured that we will either answer it personally or in the form of FAQs. So I thought I'd start off today actually with some information about how many speech pathologists and audiologists provide service in Ontario schools. And we've got this information from the 2020 self-assessment tool, just the aggregate data. So you can see how many here have identified that they work in either school boards or school-based rehab services. But in the preparation, we also found out that some school boards actually contract the services of audiologists. So really, we could say 1,200 registrants are working in the school system, a significant number. So today's e-forum is based on current information. That includes the information that was released yesterday by the Ministry of Education and the Government of Ontario. Now, the information is changing rapidly. I think you are aware of that. And I think it is going to continue to change. So please rest assured that we will update you whenever we receive any new information regarding schools. So we are asking you in exchange to please keep up to date with the CASLPO email communications and also refer to the Providing Patient Care in a Pandemic, which is on our website. So let me show you where it is. So here's our homepage. You can see COVID-19 at the bottom. You can just click on the left-hand side, Providing Patient Care in a Pandemic. You will see our practice advisories, our FAQs, some links to posters and signage, and then finally, this forum and the slides will be posted here as well as on the events page. So we appreciate that this is a very challenging time for speech language pathologists and audiologists. It's challenging for our colleagues who are teachers and for all other professionals providing services in the schools. It's difficult for families as they make the decision about whether their child or children will return. And of course, it is very challenging for the students themselves. We know that there is uncertainty out there, and we don't know how the school year is actually going to roll out. We all have to be prepared for changes, you know, within the first few weeks, within the month, or as the school year progresses. And also we know that there is contrary opinion in the media regarding the approach, the virus, safety, class sizes, etc. So really our message today is we are going to be here for you. If you have any questions, contact CASLPO. We will do our very best to answer them or to point you in the right direction. So Sarah, I'm going to hand over to you now regarding the guide to reopening Ontario schools.
Thank you very much, Alex. Yes, so we are now to address the guide for reopening Ontario schools, which was developed by the Ministry of Education while consulting with the Ministry of Health. So what we are saying is that we want you to follow your school board's requirements and directions. And for those who work in the school-based rehab services, your employer's requirements and directions. If at any time it's needed, you can contact CASLPO if your school board's or employer's information is contrary to the college's requirements, guidance, and pandemic practice advisories. CASLPO will contact the Ministry of Health for advice. But we also want to know that you can contact the Ministry of Health provider hotline. The number is here and the email. And again, just to remind you, these slides will be available on the website for all this information as well. So the Ministry of Education developed the COVID-19 Workplace Safety Plan to make schools safer for everyone. You should have access to the safety plan for each board that you service. It is CASLPO's expectation that you follow the safety plan. The guide also outlines the need for protocols regarding cooperation with external agencies, support for remote delivery where in-service delivery is not possible, and continued access to assistive technology. As speech pathologists and audiologists, you would advocate to ensure continued access to any of those students who require that assistive technology. The guide also outlines the need for criteria for accommodation of staff who have health conditions or whose family members have health conditions that would make it preferable for them to work in accommodated roles. So one of the questions that we have been asked at the college is what is considered an acceptable medical condition for job accommodations? Can I ask for a job accommodation if I have a medical condition that puts me or a family member at risk of contracting COVID-19? So the answer is that you would contact your manager or employer to discuss accommodations. If for any reason you cannot resolve those accommodation issues with your manager, you could consider contacting the Joint Health and Safety Committee, the union if applicable, the Ministry of Labour, or a lawyer versed in employment law. Another section of the guide is about voluntary learning at home. So to ensure students and families are supported and respected in making decisions that work best for them, in-person school attendance is optional for this coming school year. There will be remote learning options available for all students on a full-time enhanced distant learning basis. Obviously, you as the speech pathologists and audiologists will be checking which students are attending school in person, who can be seen in person, and which students are staying at home and may require virtual care. So this might be a welcome time to check in with Samida to see if there are any questions regarding our information up to this point.
Thank you, Sarah. Not too many. We have one question regarding virtual services. I know we're getting into that section, so perhaps we'll leave that for the time being.
Excellent. All right, so we will check in with you again, Samida, shortly after this section. So regarding virtual care, you are going to be following the school board's or your employer's direction regarding virtual care and/or in-school services. You'll be prepared to provide virtual care to the student in the student's home or in the school. And factors, as you all know, such as availability of workspace in schools, also may result in the decision about what kind of care will be provided. One of the questions we've been asked is, can communication disorders assistants provide virtual care? And yes, they can. Please refer to the position statement on the use of support personnel. It's available both for speech pathologists and audiologists, and it does apply to both virtual and in-person services. What guidance can you provide around virtual supervision of CDAs? And again, this position statement does apply. We do want you to pay special attention, obviously, when you're sharing any personal health information with the CDA during that virtual supervision. You would want to maintain those security and privacy measures. If your school board tells you that Google Classroom is the recommended platform for virtual care, is that adequate? You have to further verify the privacy and security of the platform. And what we're going to say is really, if you ever have concerns about whatever virtual care platform is chosen, then please take steps to ensure that platform does meet security and privacy requirements. Please consult with any expertise you can to help you with this. We do have FAQs available, and OSLA has also very recently printed information on telepractice platforms as well. What are the additional consent requirements for virtual care? Well, we want to share with you the consent tool that is available on virtual care. It has a section on virtual care with suggestions for obtaining consent for treatment and personal health information. So we're going to take you to where it would be on the website. You would go into resources, you would select consent and capacity. In that section at the very bottom, you will find the consent tool. Click into the consent tool. You would select the setting virtual care services, and then you would select the consent type. So as we know, there are two types, the collect, use, and disclose information, and consent for services. When you choose one of those consent facets, it will then share with you suggestions for discussion points. Remember, they're suggestions. Each of you are working in your own setting and may want to add some additional items. Also want to share with you resources that have been provided by all our amazing associations, and please take a look at them. They have many resources on virtual care, webinars for your interest. And so, sorry, I stopped there, but actually this is the place to stop for some more questions. Samida, if you could help us.
Yes, yes, thank you, Sarah. We do have a couple of questions that have come through. So one question is, a couple of registrants are saying their school boards or their employers expect direct in-person services. But the question is, can they provide services virtually if it's possible to do so, even when the employer is requesting that they provide the service in person? So can they make the decision to provide virtual services?
Excellent. Thank you, Samida. So, Sarah, we were discussing this a little bit earlier, And you would be expected to follow the school board or your employer's direction about where you're going to be providing service. However, you would always do a point of care risk assessment and an active COVID screen. We're going to talk about that in a moment. If somebody fails the screen, then they should not be seen in person. You would defer or provide alternative services. If in the point of care risk assessment, you have evidence that really points away from in-person to virtual care for that particular student, then you would contact your manager or employer and discuss the findings of your point of care risk assessment. I think that would be done on a student by student basis. Sarah, do you have anything else to add?
No, Alex, not at this time.
Excellent. Okay. Samida, another question, or shall we proceed?
I think we can proceed from here. Thank you.
Excellent. So actually, good timing. We are going to focus now on in-school services. So to begin with, we do understand that the school boards are going to be training all employees, which is fantastic. And we have reached out to some employers of school-based rehab service, SLPs, and I believe training is going to be set up for them as well. So we do have general standards on infection prevention and control. Please look at those. And as we've said before, we've got practice advisories covering all areas for providing patient care in a pandemic. Now, the guide from the Ministry of Education also states that joint health and safety committees are required to be established in each school, and that they will be meeting regularly, not only to inform the reopening plan, but also to provide information on ongoing operations. So that is going to be an important resource. So what I would like to do now is really focus on COVID-19 screening. So to begin with, I'm going to talk about self-screening. All employees, including SLPs and audiologists, as well as students, must self-screen every day before attending schools. Now, the school boards will be providing parents with a checklist to perform this screening of their children every day. And these self-assessment tools will be made available to employees as well. And of course, it just increases everyone's awareness of possible symptoms of COVID-19. You can actually find the self-screening tool on our Pandemic Practice Advisory 3. There is a link here for COVID-19 screening. The schools are also expected to carry out what the Ministry of Health call passive screening. That is, signs and posters will be put up in entrance of schools and any other area where there is a lot of people in the school. And it's to remind students and all employees, as well as parents and caregivers, of the COVID-19 symptoms and what you should be doing to overcome the risk of infection. So now we're going to focus a little bit on self-screening versus active screening. Now, if you're going to go into a school and your plan is to go and observe a student in the classroom, or just to go into a classroom and consult with a teacher, you can rely on the students or the parents' completion of the self-screen. However, if you are going to withdraw a student for a one-on-one assessment or treatment session, then as a regulated health professional, you must follow the Ministry of Health's Directive 2 for healthcare providers. And in Directive 2, it states that you must carry out an active COVID-19 screen. And again, we do have a pandemic practice advisory devoted to this area. So let's unpack the active screening. It's basically a questionnaire. What is different is that you will be carrying it out with the parents. You can do it by telephone or even virtual care if you have that facility. The screening should occur the day you plan to do an in-school visit or as close to the visit as possible. Now, you can carry out the screen, or it can be carried out by others. For example, other regulated or unregulated staff, such as office personnel or support personnel. If you are using other staff, make sure that you have a procedure in place to inform the SLP or audiologist of the results of the active screen. So we've received a question. Do I need to repeat the screen if I find out from my point of care risk assessment that an active COVID-19 screening was completed that morning? And the answer is, if you're satisfied that the results are reliable, complete, then there's no need to repeat the screening. And in fact, actually, it made us think that it would be good if you were consulting with the team, with occupational therapists, physiotherapists, social workers, psychologists. If you're going to see a child on the same day, then only one of you has to complete the screen. However, ensure all of the questions have been asked and that the answer to all of the questions is no. So another question, can the screening be done with a student if we feel they are capable of answering the questions? And the answer is yes. You would use your knowledge, skill, and judgment to determine whether the student is old enough and can accurately report. You would then document that the student was capable of answering the screening questions. So it's really up to you. So now let's talk about the results. So if the response to all of the questions in the COVID-19 screen are no, then they are considered to be negative, and you may see the student in person. If the response to any of the questions is yes, then defer seeing the student, inform the school principal, and follow the school board guidelines. So if you are in a situation where one of the questions was yes and you deferred the student, don't forget to follow up with the parents or the caregivers within a reasonable time frame to rearrange the school visit. And of course, you will be doing another active COVID screen before the rearranged visit. So we have some questions about screening and documentation. Who maintains the documentation for the COVID-19 screens and the outcomes? So everyone who carried out the screen can document the results in the student's speech language pathology or audiology record. We're not here talking about the OSR, we're talking about your record. Support personnel or others can document the results, but not forgetting that you as the regulated professional are responsible for the upkeep of the record. Another question, do we have to keep copies or is a notation sufficient? And yes, a notation is sufficient. Don't forget, if you're destroying a paper copy or an electronic form, do so in a secure manner. So now let's focus on the monitoring and the responding to a COVID-19 outbreak. So yesterday, the Government of Ontario released the operational guidance, and this was developed in consultation with Public Health and the Ontario Chief Medical Officer for Health. So how it pertains to speech pathologists and audiologists. Well, schools must maintain and make available daily records of student attendance and of any approved visitors to the school who saw a particular student. And that is for contact tracing purposes. So the important message is that you must always sign in and out of schools and make note of the time you entered and exited. Now, all school boards are going to be asked to create a COVID-19 advisory section on their website. And if a school board actually has their own website, they will develop this page as well. Now, none of the information about who has contracted COVID-19 will be on the website. But we are advising you to check these websites on a regular basis and follow the guidance about when and if it is safe to visit a school. So I believe, Samida, we're going to stop here for questions again. We've just given a lot of information. So do we have any questions?
Yes, we certainly do. We have a couple on virtual care, so I'll take us back to virtual care if you don't mind, and then a few on screening.
Okay.
So the couple going back to virtual care, we have a question about providing group therapy using virtual care and whether that would be allowed.
Yes, we have heard of this adaptation of group virtual care, and we were impressed. I believe it was trialed during the summer. Of course, it would have implications on consent, because the mere fact that a child is in a group is personal health information. So as long as the substitute decision makers, the parents, agree, group therapy for virtual care is a very good adaptation. We are not at this moment allowing group therapy in person. Sarah, anything else to add?
And I think, I think we're always saying that things will be subject to updating. So I think this might be one of those areas. Certainly group therapy in person could be something that will be changing over time. So yes.
Absolutely, good point, yes.
Mm-hmm.
Thank you. I will ask one more virtual care question. This is, the question is, do I need to document my clinical reasoning for seeing a student virtually as opposed to in person?
Sarah, do you want to take this one?
So I think with any documentation, you're always considering what, to me, documentation is always evidence, good evidence of what you are doing and providing. So I think this is a decision you'll be making yourself, how much, to what degree, what you would be writing. But you do always want the record to be a reliable piece of evidence. For example, if somebody else steps in your place, that it's clear to them as well about what you've made the decision and what your plan of care is going to be. Yes. Anything else, Alex, at all?
No, I think you hit the nail on the head. I would only add, if it's a decision about in-person versus virtual care, in other words, you do genuinely have the choice, then you might want to document why you chose. However, if your virtual care is going to be your standard form of intervention, then it would be entirely up to you.
Thank you. Okay, let's move to a couple of questions about screening now. So one of the questions is, if a student is not capable of answering the screening questions and you cannot reach the parent, the guardian or the caregiver, does that mean the student cannot receive support that day? Or can the staff work with the student as long as they are using the appropriate PPE?
Very good question. And we did clarify this with the Ministry of Health. So if you cannot do an active COVID-19 screen, you should not be withdrawing that child for one-on-one services that day. So you could adapt and join the classroom, observe. You will be wearing PPE in the classroom. You will be trying to maintain distance. So you could then maybe provide the teacher with some prompts, with some advice. You could then maybe try and contact the parents later and say, you know, I did observe your child in the classroom. Instead of withdrawing them, this helped, that helped, etc. But no, the Ministry of Health are saying an active COVID-19 screen must be carried out in order to withdraw and provide one-on-one services. Now, we are asking you to keep us up to date with regard to this, and we will be in contact with the Ministry in the future if this proves to be a significant barrier.
Thank you. And one more question on screening. Should we be keeping track of the results of our own self-screening? Should we be keeping a record of that?
I think the assumption is that you are doing it, and that all the teachers, etc., will be doing it. We will be operating on that assumption that you are doing it. Whether you are required to make note of it, we could certainly consult the other colleges and see if they are requiring, but I would think probably not. The only time you would make note of it is if you were actually feeling unwell and were, you know, electing not to go in. Sarah, what do you think? And Samida, what are your thoughts?
This is Sarah. So I would definitely, I think the main concern obviously is if you fail the screen, and then you would be following your school board's direction about what would be required at that point. But if it's negative each day, I would assume all is well.
Yeah.
Samida?
I would add that from some of the guidance documents we've been reading, it may be that the school board will have some process for keeping track of this information as well.
That's
you know, because the ministry is asking school boards to have a process in place for tracking the cases and people who test positive. So your own screening may be collected by the school board, but of course that'll become clearer as the services, as the schools open, and you know, it'll become clearer as we get into this.
Yes, absolutely.
Yes.
Thank you, Samida.
Okay, so I believe I'm to take over at this point.
Absolutely.
All right.
Thank you.
So let's talk a little bit about adapted school environments. So one of the things we know from the guides from the Ministry of Health and Education are that school boards will be expected to adapt their environments, both physically and operationally, to support the multiple protection strategies that are to be in place. So we've listed some of the adaptations that may be happening in the schools. Our advice to you is to ensure that you know what adaptations the schools are making and to follow those adaptations. So let's move into infection prevention and control and personal protective equipment in schools. So we've talked about or made reference to the point of care risk assessment a few times so far in the presentation. Prior to any student interaction, audiologists and SLPs have a responsibility to assess the risk of infection. And this is something that was always the case. Even before the pandemic, a point of care risk assessment was important to assess the risk of infection. So if this is a new concept to you, please look at the pandemic practice advice document that we have made on the point of care risk assessment. We've linked it in the slide for you. But to summarize, it would be asking yourself some questions about what you're going to do with the student, how close you're going to be to the student, in what environment are you going to be providing the services, and then based on that, making decisions around maybe adapting your service to reduce the risks, maybe choosing certain equipment over other equipment or reducing the amount of equipment you will use, and then other infection prevention and control measures like cleaning and disinfecting surfaces, equipment, and of course, selecting the personal protective equipment that you will be wearing. Hand hygiene, extremely important. It is one of the most important things that we can do to limit the spread of infection. So we know from the guide that schools will also be training students on hand hygiene, scheduling breaks for hand hygiene, and that students will be expected to follow these practices. And of course, you will be following these practices as well. And if you're visiting multiple schools, we would advise that you have your own hand sanitizer. And we have linked several resources here for you on hand hygiene, including a short video and a poster from Public Health Ontario. So let's move into masks. So let's begin by talking about students and the requirements for students in school when it comes to masks. So from the guide, we know that students in grades 4 to 12 will be required to wear non-medical or cloth masks in school, including in the hallways and during class. Some school boards are also requiring students in kindergarten up to grade 3 to wear masks in indoor spaces, but we've learned that other boards are encouraging that these students wear masks, but not requiring it. So again, it may differ based on the school. Non-medical masks will be made available by the schools for the students, with reasonable exceptions on the requirement to wear masks. Now let's talk a little bit about students in SLP and audiology sessions. So during a session, if you are withdrawing a student, and it is important to see the student's face during the assessment or treatment, you can ask the student to remove the mask temporarily. Remember to remind them to put the mask back on before they leave the room or go back to their classroom. Moving on to us as SLPs and audiologists and wearing masks. Now the school boards will require you to wear masks, or maybe even masks and face shields, with reasonable exceptions for medical conditions. If you are in close contact with students with medical or special needs, the guide says that you will be provided with additional appropriate PPE, such as gloves or gowns, for example. Continuing with what we are to do as SLP and audiologists. So when you withdraw a student for services, and it is essential for that student to see your face, you may opt to use a face shield or a clear mask. Remember when you're making this decision to complete the point of care risk assessment. So of course, when students have a significant hearing loss, if the student requires visual information to support the verbal message, or if you're doing some teaching or modeling that requires the student to see your face, you would need to perhaps wear a face shield or a clear mask. And we've heard from some of our audiologists and SLPs about concerns over whether school boards will provide this PPE. Hopefully they will, but if they aren't, then advocate for that. Explain the reasons why it's important for you to have it and advocate to have that PPE provided. A frequently asked question has been, are there any ministry approved clear masks or face shields to accommodate hearing or communication issues? And the answer is yes, there are. We've provided some links to resources where you can find out some more information about this, including the ministry supplier directory, where you can actually search for ministry approved suppliers of face shields and clear masks. Talking a little bit more about face shields, we often get the question around what is the appropriate face shield to be wearing. And this is an excerpt from our pandemic practice advice article number 4, where we describe that for optimal protection, the face shield should extend below your chin, anteriorly to the ears, laterally, and there should be no exposed gap between your forehead and the shield's headpiece. It's very important or essential to ensure that no part of your face is exposed for optimal protection. Another very common question that we've received is, can I wear a face shield by itself when a student has screened negative for COVID-19 symptoms? And the answer is yes, you can wear a face shield by itself in this circumstance. However, remember to carry out your point of care risk assessment with each student to ensure that that decision to wear a face shield alone is appropriate. Of course, you're also always going to perform hand hygiene and, if possible, maintain the 2-meter physical distance if that is a possibility. So I believe here I'm handing it back to you, Sarah, to continue with information on personal protective equipment.
Thank you very much, Samita. So we're going to dive into the PPE questions that we've received. So what are the PPE requirements for adult helpers of students like EAs, CDAs, itinerant teachers, SLP assistants? So these professionals are employees of the school board. They will have received the infection prevention and control training and will be following school board guidance regarding the use of PPE. And if you are working with or supervising support personnel, please ensure that they are advised of the PPE requirements. Now, the question we have received is, do we follow the school board's PPE requirements or Public Health Ontario's guidance as advised by the Ministry of Health? So yes, we are regulated healthcare professionals and as such are required to follow the Ministry of Health's Directive Number 2 and Public Health Ontario. Now, those ministry and the individual school boards' requirements should be aligned. If for any reason they are not, then you certainly can contact us at Practice Advice. So we understand with physical distancing, the realities in schools are that you probably can't maintain a 2-meter distance. So you are going to be ensuring you carry out a point of care risk assessment to determine what PPE is required. You will be wearing a mask or a face shield. You will be carrying out hand hygiene and ensure that your equipment is cleaned and disinfected before and after each session. Another question we've had, actually more related to physical distancing and maybe finding space, is can we provide therapy in the schoolyard or other outdoor area? And yes, if it's appropriate, please find a private, quiet area of the schoolyard with limited distractions. And certainly there need to be backup plans for the weather. And how do we mitigate privacy or confidentiality risks in an outdoor area? So you would discuss this plan of care with the parents and obtain their agreement for providing service outside. You would monitor the area and please ensure that others are not around if there's confidential personal health information being shared. So Samita, actually at this point, I think it would be nice to check in with questions that we're receiving from any of you out there. Are there any that you would like to bring up?
There are quite a number that have come through. I'm still going through them.
Okay.
There seem to be a few that wants a clarification on what we had said about the need to do the active screening still by the SLP or audiologist, even if the parents are being asked to screen their children before they send them to school. So maybe I think we might answer a number of questions just by reviewing that information.
Absolutely. Thank you, Samita. And yes, we very specifically contacted the Ministry of Health. We explained the role of speech language pathologists and audiologists in the school, and they took that information and they consulted amongst themselves. They got back to us here at the college and they said, you are regulated health professionals. You have to follow Directive Number 2, and it does require you to do an active COVID-19 screen if you are going to be seeing a child individually, one-on-one, and taking them out of the classroom. So again, keep us up to date, keep your managers up to date. We will reach out to managers, and if this proves to be a real barrier to the provision of care, we will go back to the Ministry of Health. But at the moment, that is their direction. So maybe, Samita, we should carry on with the presentation and hopefully have time for a question or two at the end.
Sure.
So, Sarah.
Okay. Thank you, Alex. So we will continue with the cleaning and disinfection portion of this. So we want you to know there are many resources on our website under the General Standards, Infection Prevention and Control. Many fabulous links looking at what you can do in clinical office space. There's best practices for environmental cleaning, giving you tips on types of disinfectant, cleaning equipment, decision charts, general cleaning practices. And again, we also in our pandemic practice advice, number 8 has also additional information on equipment and materials cleaning. So in general, obviously, you're going to be looking at the assessments you're using, treatment, objects, books, and toys. Really try to reduce the number, and you're going to try and select materials which can be easily cleaned and disinfected if touched or used by the student. One of the questions is who is responsible for cleaning when you're visiting the different schools? So you would want to review the workplace safety plan of each school and seek clarification on the following. Who is responsible for the cleaning of shared spaces in schools? Who is responsible for cleaning school equipment pre and post sessions? And what additional cleaning or disinfection supplies will be needed when you are traveling from school to school? Samida, you were going to help us out with this slide. Thank you.
Yes, thank you. So this is a common question that we've received from some of the audiologists, and it has to do with cleaning and disinfection of hearing systems. So what about infection control with hearing systems, such as FM system transmitters, remote microphones, pass-around microphones that may be used by multiple people? So our advice for this is to consult with the manufacturer's instructions on cleaning and disinfection. Many companies are providing this information, including the appropriate disinfectant to use for these hearing technology devices, and even procedures and steps to follow when you're doing the cleaning. And then, of course, part of your role in the schools would be to educate the teachers and the other professionals working with the students on how to appropriately clean and disinfect the hearing equipment. Now, if you can, you may also provide some recommendations or consider how to reduce the use of this technology. We have heard some concerns that because multiple teachers would be using the microphones and multiple students, that people may not be comfortable in the schools doing this in the way that it was done before. So if you can provide some recommendations to reduce the number of people that would use the microphones, or maybe recommend more sound field systems, for example, that could be part of your role as well. And then, of course, refer to our general standards on infection prevention and control. There are many helpful links in that document. Back to you, Sarah.
Thank you. Thanks very much, Samida. So another very common question we've been receiving is multiple school visits. So how many schools am I allowed to visit in a day? So you will be following the guidance provided by your own school board regarding multiple visits. When we consulted with the Ministry of Health, absolutely they're aware that health professionals will be visiting multiple schools, and their advice is to make best efforts to limit the number of visits to different schools in one day. What additional measures are required if we visit more than one school during the day? So for sure, you want to remain current regarding information on which schools are experiencing a COVID-19 outbreak. You will follow the school board's or employer's guidance regarding visiting an outbreak school. And when you leave one school, before visiting the next, you want to ensure you dispose of your PPE safely, you perform hand hygiene, and you clean and disinfect equipment. And lastly here, check that the student in the next school is there and that the school is safe to visit.
Thank you, Sarah. So I'm going to take over now and just discuss professional liability insurance. We've had some questions. Are there any changes required by the college? And the answer is no. Registrants have to have professional liability insurance in accordance with the bylaw. However, other insurance may be being required by your employer, or you yourself may choose to take out additional insurance for cybersecurity or virtual care. You can always consult with the professional associations who provide a lot of support for insurance. So now, thinking about some adaptations to intervention in the schools. Can we instruct students to use something such as a single-use pointer instead of touching assessment materials? Yes, you can. It's a good adaptation. However, make sure the child can effectively control the pointer so that you can rely on their responses. Take all measures to ensure safety and reduced transmission of infection. So another adaptation, this time concerns standardized tests. So just to remind you, CASLPO does not require the use of standardized assessments. If you do decide to use one virtually, be aware of how the interpretation of standard scores could change. Maybe look for a virtual version of the assessment. I know that assessment companies are looking into developing virtual versions, or of course, you can use an informal assessment measure. Can we use tactile prompts with in therapy with children? Yes, you can, but really consider if it's clinically necessary. If it is, you're going to do your point of care risk assessment, you're going to select PPE, and this time it will include gloves, because we're saying you should wear gloves if you're touching the face or mouth. We also recommend that you inform parents that this is going to be part of your plan of care and get consent from them for touching their child's mouth or face. So a question with regard to documentation. Do records need to include mode of service, virtual or in person? And the answer is yes. You are required to document the date and purpose for each professional contact with the patient and whether the contact was made in person, by telephone, or electronically. With regard to this information in reports, follow your workplace policies on your reports and report content. So we have come to the end of the presentation. I believe we have about 3 minutes or so for additional questions, and then we have just a couple of wrap-up slides before the message from the university. So maybe, Samida, one question, maybe two.
Sure, and again, I'll just reiterate that thank you for your questions. We've received all of them. We won't be able to answer them all, but I'll ask one that's a bit reoccurring is the information on face shields. A few of our registrants are saying that they have been advised that wearing a face shield alone is not advised, and so are asking for some clarification on that issue.
Excellent, excellent, thank you. So I am pleased to say this isn't so much CASLPO speaking, rather we are informing you of Public Health Ontario's information. So Public Health Ontario do a great deal of research, and they have said in cases where it is essential for the student to see your face, that you can wear a face shield on its own. Now, of course, you're going to be doing your point of care risk assessment and everything, but if the child or student does not need to see your face, you can wear a mask and a face shield, or you can ask for a clear mask. And Health Canada has approved one, I believe, or maybe even two types of clear mask. So really your question is, does the child need to see my face? Does the student need to see my face? And then after all of the precautions, yes, you can, according to Public Health Ontario. But remember, you have to follow that criteria. So I think, Samida, one other quick question.
Sure. There are some questions around whether it is necessary to get the parents' consent around these types of things, around needing to remove the mask from the student during the course of the therapy or the SLP session, and whether they should be informing parents that they will be wearing PPE, and so on. So the importance of parent consent for removing masks.
Excellent. Sarah, do you want to take this one?
I mean, I think it's going to be on a very individual basis, isn't it? Because I do believe the understanding is that a couple of students do not have to wear masks because of their own issues or concerns. So I don't think there's a straightforward answer to this question. Samita or Alex?
I think we are in the business of good communication, and this is the time where good communication is absolutely essential. As I said at the beginning, there are many parents and families who are very anxious about their children going back to school. So I think that the more information that you can give a family about your adaptations to your plan of care, the better. It will reassure them, it will reassure you. Now, I think that that is best practice. Whether you are absolutely required is another matter. Of course, we do have part of the consent to service does include risk. And so, you know, you might want to bring up some information there on how you are mitigating the risk, because Public Health Ontario and the Chief Medical Officer of Health have said that returning to school is safe as long as you are taking all of the precautions, including the use of PPE following infection prevention and control. So I think we'll leave it there, Samida and Sarah, and we'll just finish up with our specific message to you. And that is, as we said at the beginning, this is difficult. And we want you to know that we will be providing you with ongoing registrant support. It might be that we'll be doing additional e-forums specifically for schools. We will certainly be adding or revising our pandemic practice advisories, answering all of your questions from this e-forum. And we do have the information there to contact us. So please do not hesitate, reach out to us. Now, if we cannot answer a question, we will either point you in the right direction, or we will go to the Ministry of Health, or we will consult with the other regulatory colleges whose members are providing services in the schools. So please know we are there for you. So I am now going to just go on to our last topic, and this is a message from the Ontario universities. Clinical education is so important for SLPs and audiologists. I think we all agree with that. And the universities are requesting additional clinical educators. There has been a backlog of students requiring placements. And they go on to say, and I think this is very true, that SLP and audiology students are in a unique position to really help with the technology around the provision of virtual care. And so much so, they've actually developed models of clinical education in virtual care placements. Now, there's a lot of very good information in these slides. I also want to let you know that the college will be communicating to the entire membership, all audiologists and speech language pathologists, this information as well. So you will see it again in a communication. They do have some extra information on the supervision of actual virtual care placements and some resources you can see there at the bottom for virtual care and guidelines for virtual supervision. So they have also considered safety with regard to in-person clinical placements. So as I say, keep your eyes open for communication from the college, but regarding this request from the universities with the information of who to contact if you are considering becoming a clinical educator. So we have come to the end of our presentation. I would like to take this opportunity really to thank you for attending, for being so concerned about providing quality care and appropriate and safe care to the students that you service. We would also like to thank the school boards that we reached out to with some of the content of these slides. And we also reached out to one of the children's treatment centres as well. So thank you very much for your support as well. We are so pleased that we can always count on coming to you for additional information. And finally, I would like to thank Sarah and Sumida for, we prepare this as a team, we present it as a team, and thank you both very much.
Thank you very much, Alex.
Thank you, Alex.
Excellent. So we will now say goodbye and stop the webinar.